Well, again, good morning. Thank you for joining us. My name is Amber Jurgen. I am with PCA Skin, and I am excited to demonstrate one of our advanced chemical peel protocols that's specifically targeting hyperpigmentation. And as we work through the protocol, I'll highlight what we're using, specific ingredients that are in the products, mechanism of action, and why they are the chosen formulation for treating hyperpigmentation. Okay, just a little bit of background on me. I'm our education manager. I've been with PCA for just over 21 years. So I know quite a bit about the brand. So if you have any questions outside of what we're doing today, please feel free to ask anything that's on your mind. I am here for you. I know your time is valuable, so I certainly want to make sure that I answer all of your questions. So today we have our model here, Kristen, who is specifically concerned with UV-induced hyperpigmentation. But I do want to say that this specific protocol is also designed for treating hormonally induced, so our melasma, as well as our post-inflammatory hyperpigmentation. The ingredients in the products are going to target that melanogenesis chain, inhibit the overproduction of melanin. So why don't we go ahead and get started? Okay. So within our chemical peel protocols, we always start with a cleanse. And we use our facial wash for oily problem skin, which is a really nice lactic and citric acid gel cleanser. Now I'm just going to use a cotton square to cleanse Kristen's skin. You can certainly just use gloved hands. There are a lot of physicians that will have their patients just cleanse their skin on their own, and then they just move right into the treatment. So whatever works best for you is certainly okay. Kristen does not have a lot of makeup on. Her skin is quite clean, so we're just going to need to do one cleanse. On occasion, you will have to do multiple cleanses, which is completely okay. This protocol can also be carried down into the neck and décolleté if need be. That's actually quite a common practice. Okay. And if you do have audio on your device, it looks like you can actually just talk, and I should be able to hear you if you have a question. I'm just going over her skin with some water just to remove any cleanser that is sitting on the surface. Okay, our second step in the protocol is going to be to prep and degrease the patient's skin. Now we're going to be using our smoothing toner. That is, again, a combination of alpha hydroxy acids. Now, if you are in the practice of wanting to degrease a little bit more and use acetone, that is certainly okay. We prefer the smoothing toner because it doesn't remove all of the healthy components of our extracellular matrix, but still degreases the skin nicely to get that even penetration and absorption. This is also when we gauge the patient's sensitivity, just to make sure that the protocol we have chosen, the products we're planning on using, are still appropriate. Ever so often, you'll have a patient that has extreme sensitivity, which we would not know until we apply this degreasing step. And it's like our safety net. So again, we choose the most safe and effective chemical peel for that patient on that day. So Kristen, on a scale from 1 to 10, 10 feeling a lot of burning, a tingling sensation, 1 feeling nothing at all, where are you at?
I'm about a 1.
She's at about a 1, which is exactly what we expect. If she was hypersensitive, it would be a 5 or higher. At that point, we might want to do something a little bit more conservative. But she's good. She's tolerating the toner well, so we know we're safe to move forward. So at this point in the protocol, it is when we're going to select our first chemical peel option. And so what our first chemical peel application is going to be is our modified and enhanced Jesner's peel. So that is going to be our family of PCA peels. So here's an example. We have 3 to choose from. This was the first chemical peel formulation that PCA Skin launched. It is really what put us on the map with formulating innovative chemical peels, because when the company was founded back in 1990, one of the most common chemical peels used at that time was the modified Jesner's. And it was a really nice blend of key ingredients. So modified Jesner's consists of 14% salicylic, 14% lactic, 14% resorcinol. So you have your beta hydroxy acid, you have your alpha hydroxy acid, and the addition of resorcinol, so an added flaking agent. So multiple benefits, and it's in a base of alcohol. We took that formulation and enhanced it with melanogenesis inhibitors. So we added hydroquinone, we added kojic acid, and we added citric acid. So it's specifically targeting hyperpigmentation a little bit more efficiently compared to
carry this line. Is that why?
And enhanced measures. So we have 3. We want to be able to treat all Fitzpatrick skin types.
Stuff, not us.
So we have one PCA
so available
with hydroquinone or without hydroquinone. And then we have the most aggressive, most powerful that has hydroquinone as well as resorcinol. The most common formulation used
kojic acid in it too
is the PCA peel with hydroquinone. And so this is going to be appropriate for 1 through 4. So we're going to go ahead and use that formulation today. The maximum number of layers is 6.
I thought it was more like
how we apply it is onto a cotton square, and we take 5 dots, just like this,
which is good for our esthetician.
in a formation of a flower. So it's difficult to see because it's a very light color. It's almost clear, but the point being is you don't want to put the dots right on top of each other. You want to spread them apart for a better working area. And I'm going to basically swipe the chemical peel onto the patient's skin in an even layer. I'm taking it up to the orbital bone, right above the eyebrow. And this is going to be considered our first layer. So again, this is the PCA peel, which is our modified and enhanced Jesner's formulation. But we've added hydroquinone, kojic acid, and citric acid. So a little bit more effective in treating all forms of hyperpigmentation. So Kristen, on that 1 to 10 scale, tell me what number you are at.
I'm at about a 3, but it's starting to go down a little bit.
Okay, so she increased to a 3, but it declines quite rapidly. So we're going to go ahead and apply a second layer in the same way we applied the first layer. So evenly apply that second layer of the PCA peel. And so this is essentially helping us to loosen the stratum corneum. So as we move in to our next peel formulation, we'll get really nice, even, deeper penetration. Okay. Karen, do you have a fan? Or actually, it's right there if you can grab that for me. Thank you so much. Thank you. So typically we fan in between peel application layers just to help with the patient be comfortable. But it is still quite tolerable. Okay, so it looks like it's a little bit, oh, so if you do have a question, you can absolutely unlock your microphone, but if you're not speaking, it's best practice to actually turn your microphone off, and so there's not additional feed that can be a little bit distracting during the presentation. So you can open your microphone and close it when need be. Okay, for demonstration purposes, we are going to stop with 2 layers of the PCA peel. And now it's our opportunity to move into a second type of chemical peel formulation, which today we're focusing on trichloroacetic acid. So PCA has 3 different TCA blended peels. We have one that's at a 6%, one that is at a 12%, and then the most aggressive that is at a 20%. What's really nice is that we've complemented the TCA with lactic acid and an abundant amount of melanogenesis inhibitors, again, targeting that pigment. We're using kojic acid, we're using L-arbutin, we're using citric acid, and so a really nice addition to target that overproduction of melanin. For today's demonstration, I'm going to use this 6% formulation, which is referred to as our Sensi peel. But if appropriate, you can certainly use the 10% or the 20%, just depending on how deep you want the penetration to be. Our Sensi peel is appropriate for all Fitzpatricks, so 1 through 6. It is the go-to formulation for skin of color because it's not going to aggravate the patient's skin. It's not going to create too much cutaneous inflammation, so we're not at much risk of stimulating melanocyte activity, but at the same time introducing all of those key ingredients. So it's the best of both worlds, key ingredients without cutaneous inflammation, so we don't trigger those melanocytes. All of our TCA blends are a maximum of 4 layers. Unless you are trying to achieve protein coagulation, if you want that full face blanch and you want that medium depth peel, then there's no maximum layers. And if that's the goal you're trying to achieve, that's the patient outcome you want, then you're going to want to use our 20% TCA peel, which is the Ultra Peel Forte. So again, we like to give physicians options because every patient is different and we want to be able to treat all Fitzpatricks safely. Okay, Kristen, how are you feeling on that 1 to 10 scale?
Great. I'm probably a little higher than the 3, maybe at 4.
So she's back up to around that 3 or 4 range. She has a little bit of erythema, some edema, but she's tolerating it really well. The sensation is not too traumatizing, so we're going to go ahead and move into a second layer of the Sensi peel. So same application method. Okay, we're going to evenly apply it to the patient's skin, again, right up to that orbital bone, above the eyebrows. Now, you can see my pattern is starting on the jawline and working the way up her forehead and back down. You can follow any pattern that you are comfortable with and in the habit of using. Everybody has their own pattern. Okay, so we've applied 2 layers of our modified and enhanced Jesner's, 2 layers of our Sensi Peel, the TCA blend. Now the stratum corneum is really nice and loose. We're gonna move into the next step of our protocol, which is where we customize with corrective serums. The corrective serums are going to be selected dependent upon the patient's concern and skin type. So today, since we are targeting pigment, we are going to first spot treat with our pigment gel. This is a 2% hydroquinone spot treat with azelaic acid, citric acid, lactic acid, and it is a product that we would want a patient to continue to use at home, and ideally have been using a week to 2 weeks prior to the chemical peel to prep her skin. So we're just going to spot treat some areas of discoloration. The next corrective I'm going to apply is, this is a newer formulation for us. It's our vitamin B3 brightening serum. It has 6% niacinamide. I'm going to use 2 pumps and apply it over the entire surface of the patient's face. Niacinamide is quite amazing in that it is a melanogenesis inhibitor, but it also inhibits glycation. So it helps to target the yellow hue of our skin that happens as we age, and it inhibits vascular dysfunction, so it targets redness as well. So it really is great in providing nice, even, bright skin and targeting brown, red, and yellow. So that's the second corrective that we would want our patient to use at home to maintain results, protect the investment of her professional procedure. And then we will end with our antioxidant. It's our vitamin C and E. It has 20% L-ascorbic acid. So in studies, we've seen that the skin can metabolize up to 20%. So that's really the percentage we look for to get the most benefits out of it. And we blended it with 5% pure tocopherol. So we have the synergy between the L-ascorbic acid and the vitamin E working together. This is an anhydrous formulation, so there's no water. So the ascorbic acid does not oxidize. It's wrapped in a silicone liposome, so it's protected until we actually apply it to the skin. It breaks, it releases the 20% vitamin C, and then does everything it needs to do in the skin at that time. So we are going to incorporate a third professional treatment into this protocol. So really this is a triple synergy chemical peel. We've applied the modified Jesner's, we've applied the TCA, we have enhanced with correctives. The third chemical peel is going to be our retinoid booster. So today, Karen, if you would mind, just grab a packet and if you can cut it open. We are going to apply our 4% pure retinol peel. What we want to do, and is occlude, thank you so much. Before applying the 4% retinol peel, occlude with Aquaphor around the orbital bone. It just tends to travel, and post-procedure can create a little bit of sensitivity in these areas. So it is a nice practice to occlude so the patient doesn't have that discomfort post-treatment. Protect the lips. So around the vermilion border, and then the nose. So our 4% pure retinol peel comes in individual packets. So it's 1 packet per treatment, which makes it really nice and easy to dispense. I'm going to dispense the entire amount in the packet, and it's a cream consistency. So you just lightly massage it into the skin. Now, because we're applying the retinoid booster and it's a pure retinol at 4%, in doing so, we are going to expect the patient to have a little bit more visible exfoliation than if we opted to skip this step of the treatment. But keep in mind, it is an optional step. We would always recommend using it unless that patient was concerned with the amount of visible exfoliation. There's still no downtime. The patient won't be peeling in sheets, but they will want to have a nice moisturizer on hand over the next 5 days post-procedure to keep their skin hydrated and comfortable. So after the retinoid booster, we are at the end of the treatment where we're going to finish with a product to calm the skin, help to bring the pH of the skin back up, and protect with SPF. So that's going to be our Rebalance, which has essential fatty acids, oil of borage, evening primrose. Just going to take 1 pump of that, and then I'm going to take about a pea-sized amount of our Hydrator Plus, which is our SPF 30 full broad spectrum block. And this way I know my patient is protected before they go out for the day, leave my treatment room. The cost of this treatment is going to range anywhere from $300 to $600 depending on demographics. And for post-procedure kits and the cost of the treatment. This provides the patient with specific products to continue to soothe their skin, and typically the patient only needs to use it 5 to 7 days, just depending on there are also instructions on what to do, what not to do post-procedure, so it's very informative for the patient because we all know it's difficult to remember everything that the physician or clinician communicates to them during the treatment. So it's all covered in this kit. Again, we just recommend including it in the cost. It's 1 treatment package. And that concludes the treatment for today. Does anybody have any questions at all? You can see here. What is nice is that this protocol, this demonstration is being recorded, and so it will be available to you through the MedResults website, so you will be able to access that and go back and revisit any information that you would like to cover. We are also available for any questions that you might have in regards to the products we use today or other products within our line. We are here to help you and assist you in any way that you wish. And our contact information is 877 PCA Skin. So please do not hesitate to reach out to us. I hope you enjoyed the presentation. Thank you for your interest in learning more about PCA Skin. I hope you have a wonderful rest of your day.